Well, it's that time of the year when it seems like we are constantly eating, from Thanksgiving dinner to Christmas cookies, maybe even fruitcake, sweet potato pie, cornbread? No, okay, stay to script. And then eventually, comes the New Year's. The New Year's resolutions to go on a diet. But a new study suggests that a lifelong habit of gaining and losing weight, they call it yo-yo dieting, puts excess strain on your heart. Dr. Jen Caudle is here. She's a family physician and assistant professor at Rowan University School of Osteopathic Medicine. So first of all, Dr. Jen, good to see you. What, though, is this yo-yo dieting, and what does it do to the heart? How bad is it on the heart?
That's a great question. Well, actually, that's really what researchers wanted to find out, too. Many of us through the years will gain weight, we'll lose weight, we'll gain it and lose it. The question is, does that damage our heart? Researchers in an abstract that was actually presented at the American Heart Association, what they did was they evaluated over 150,000 postmenopausal women and looked at them over 11 years. And what they found was that the women who were of normal weight, who yo-yo dieted, that means they gained weight, they lost it, they gained it, they lost it, they actually had a 3.5 times increased risk for sudden cardiac death and a 66% increased risk of dying from coronary artery disease compared to women who did not fluctuate in their weight. So as a result, the study researchers are saying that perhaps there's a connection between yo-yo dieting and heart disease.
But I mean, how much weight are we talking about, Dr. Jen? We all sometimes say, oh, I've got to button up a little bit and tighten up, I should say, and, lose a few pounds. So when you say yo-yo dieting, what sort of weight fluctuation are you talking about?
Well, I think that's actually a really great question. And something we have to keep in mind with this study is that it's an observational study, which means that we can perhaps say might be an association between this yo-yo dieting and heart disease, but we actually can't prove its cause and effect. And there are also some other variables. One, kind of the question that you're mentioning, the study relied on self-reporting. So the women kind of defined if they thought that they were normal weight or overweight, etc. There were also only postmenopausal women in the study. So there were a number of things that really need to be controlled a bit tighter for, which is why we actually say we need further studies to say definitively that yo-yo dieting affects the heart.
Dr. Jen Caudle, happy holidays to you. Effective, I can say that, starting Thursday, so we'll talk to you later. Thank you so much, Dr.
Happy
Jen.
holidays.
Take care.